The Portex brand from Smiths is a recognized leader in quality airway management medical devices. At Smiths, we are constantly developing new products, ensuring that our entire range meets changing clinical requirements. The Portex cricothyroidotomy kit is a result of those developments. In difficult environments where emergency medical care has to be administered efficiently with the minimum of delay, you need equipment that you can trust, that is quick and intuitive to use. In the field, when you are presented with an upper airway obstruction where tracheal intubation is not possible and all other methods have failed, an emergency situation arises. Performing a cricothyroidotomy may be the only option in providing the patient with an airway. The Portex cricothyroidotomy kit, the PCK, is purpose-designed for this occasion. It is designed for use by any clinically trained person needing to perform a cricothyroidotomy. Responding to the needs of medics in the field, Smith's research showed that the PCK needed to be reliable, quick, and easy to use.
Firstly, it would have to be fit for purpose, and that means establishing a good airway rapidly, which would also be big enough to ventilate through, which some of the present kits aren't able to do. It would have to be very safe to use. That is not only from the point of view of being easy for people with minimal amounts of training, but also some sort of indication about where you were in the airway. First of all, that you got into the airway, and secondly, that you hadn't damaged any other surrounding structures, such as the back wall of the windpipe.
The packaging is robust, making it ideal for military and civilian rescue services. The pre-assembled PCK kit requires minimal preparation before use. The product incorporates a Verus needle, which gives an immediate visual indication of entry into the trachea. Once in the trachea, the needle also provides indication of contact with the posterior wall, allowing the user to minimize posterior wall damage. The airway is established using a 6mm Portex airway tube with integral moulded flexible flange and fitted with a Portex soft seal cuff to seal the airway. The tube, dilator and needle are aligned and keyed together to position the beveled point of the needle away from the posterior tracheal wall. Cricothyroidotomy is an emergency procedure used to establish a clear and patent airway. This means it will be performed for upper airway obstruction, such as impacted foreign body and trauma. The patient should be positioned supine, with the head hyperextended on the neck by placing a small sandbag or rolled sheet beneath the shoulders. Patients with suspected spinal injuries should be immobilized before starting the procedure whenever possible. Take care at all times not to cause additional injury to the patient. It is recommended that the introducer be lubricated to facilitate its removal from the tube during the procedure. It can also be applied to the outside of the cuff. So let's see the PCK in use. Stabilize the trachea and locate the cricothyroid membrane by palpation of the depression immediately below the prominence of the thyroid cartilage. Make a 2-centimeter long horizontal incision through the skin only over the cricothyroid membrane. An adequate length of incision is vital to ensure the tube will pass through the skin easily. Hold the device with the thumb on the needle hub and the forefingers under the tube flange. The key, engaged into the flange, must face uppermost towards the patient's feet. Along with the grip, this will enable correct alignment of the PCK and operation of the unique Verus needle. Failure to observe the red indicator flag at all times may result in misplacement of the device or trauma to the posterior tracheal wall. With the trachea stabilized, place the needle tip into the incision centrally over the cricothyroid membrane perpendicular to the skin. Insert the device whilst constantly observing the red indicator flag and the needle hub. This confirms contact of the blunt stylet needle with tissue. Advance the device until a loss of resistance is felt and the red indicator flag and the needle hub disappears, confirming entry into the trachea. Aspiration may be confirmed by using saline or air in the syringe, attaching it to the clear hub. Continue to carefully insert the device at the same angle until the red flag is observed to move again in the needle hub, confirming contact of the blunt stylet with the posterior wall of the cricoid cartilage. Angle the device into a caudal direction and advance it 1 to 2 centimeters into the trachea. If the red indicator flag is observed to move at this stage, do not insert any further. Movement of the red flag indicates contact with the posterior tracheal wall at this stage. Remove the needle and, whilst holding the dilator stationary, slide the cricothyroidotomy tube off the dilator and fully into the trachea. Slight twisting of the dilator within the tube may assist at this stage. Inflate the cricothyroidotomy tube cuff with the minimum volume of air to form a seal. Secure the cricothyroidotomy tube with either the tube holder or sutures provided. Where possible, suction the trachea to establish a clear airway. When possible, confirm correct cricothyroidotomy tube placement using currently accepted techniques such as auscultation, capnography, bronchoscopic visualization, and/or chest X-ray and oximetry. If appropriate, attach the supplied Thermovent THME to the cricothyroidotomy tube in order to avoid possible occlusion of the 15mm connector by the patient's chin, provide humidification, and to protect the airway from gross contamination.
I think the Veris needle is a very significant advance in cricothyrotomy. It's the first time it's been used in this area. Firstly, it gives you an idea of exactly where you are when you reach different structures and different tissues. Most importantly of all, you don't always know how wide the trachea is, and therefore in the past there's a very high risk of going through and damaging the posterior wall. The Veris needle significantly reduces that risk. And by the sheer visibility of it, it not only improves the safety, but improves the ease of use for people too. Importantly, it's got a lot less steps than some other cricothyrotomy kits, and that's going to make it very applicable in the field, easier to teach.
The PCK has proved to be simple and reliable to use, particularly because of the unique needle placement indicator. It will prove to be a valuable piece of emergency equipment for a range of clinical scenarios. Contraindications are children under 12 years of age, fracture of the larynx, and uncertainty in identifying the anatomical landmarks. Always read the manufacturer's detailed instructions for use before conducting this procedure. Portex is a brand of Smiths Medical,